welcome. I'm glad you're all joining us. These are very unusual times for us here in Wayne Highlands and at Damascus and at Preston, where I am right now. But we're finding our way through. One thing that we've talked a lot administratively about this whole process is we've reminded ourselves from time to time that we've never done this before. We've never talked about opening schools in the middle of a pandemic. We've never talked about offering parents options and not just having school be our option. So, as we go through this process, I thank all of you for your patience and for your willingness to let us work with different ideas as we try to work through what's going to be best. We've also got circumstances where we have guidance that comes to us from the state level and sometimes even the national level that dictates some of what our decisions end up being. So I always hold out the caveat that anything I say tonight, even though I'm very confident in our plan and I'm very confident in where we are right now, we're hoping it doesn't change, but it could. So hang with us. And for now, this is where we are. I'm proud to be able to present to you tonight a plan for reopening our schools. Mr. Miller, if you'd go forward a slide, please. Over the last week, Mr. Fregoletto presented to our Board of Education the full plan for reopening that is available on our district website. Some of the resources along with that plan that you'll find there include a timeline as well as initial survey results that came from the survey that was distributed around our school district in June, as well as an important video that I hope you'll take a moment, about 12 minutes. It's a video from the head physicians at Wayne Memorial Hospital who have dealt with the COVID-19 pandemic. And it's well worth watching. It really is. You'll find and learn some things that you've heard before, and you may learn and hear some of the reasons for things that you've heard, maybe gain a different perspective about some of those things along the way.
Here come Grandma and Papa.
We've got a family gathering going on in the background. I would encourage you to take some time to watch that. A lot of what we're going to talk about this evening, and some of this is referenced, a lot of this is referenced in that video, has to do with mitigation. Okay, a lot of what we're going to talk about has to do with commonly understood strategies and techniques for mitigating or slowing or stopping the spread of the coronavirus. And those mitigation musts that I'm going to refer to throughout the night have to do with the three things that are listed on this slide and the three things that you've heard over and over and over again. And that has to do with social and physical distance. The recommended number of 6 feet is not by chance. And Dr. McVeigh in the Wayne Memorial Hospital video does a great job of explaining how that 6-foot distance has to do with the amount of space needed for gravity to take hold of those respiratory droplets that we all expel when we're talking, when we're breathing. And that's the amount of space that it's understood that those droplets will reach the ground or reach a surface before they would reach another person. Okay, so that 6-foot distance is a very important number. Now, we've also understood that that distance could be as small as 3 feet. So there's going to be times tonight where I refer to 3 feet. What we have learned is that a face covering, a mask, is an effective strategy for keeping our own respiratory droplets from expelling to the distance of another person. Okay, so we understand that when we have a face covering or a mask, that our respiratory droplets should be contained. When we're inside of that 6 feet, that is a must. Okay, so everything I referred to tonight will have to do with wearing a mask when we are not able to maintain that physical distance of 6 feet. The last thing that is a mitigation must that I'll reference is hand washing and sanitizing. Dr. McVeigh, again in that video, does a great job of explaining how 20 seconds using soap is an effective time for the soap to, he uses the term emulsify or mix with the various substances on our skin, and then rinse away using water. So those mitigation musts are things that I'm going to refer to throughout our plan and throughout how we talk about what Damascus School will look like in the fall. All right, you can go forward a slide, Mr. Miller. This slide is one that is publicly available. This is the slide that is from our district website. And this is a quick overview, and I'll talk a little more about these in detail, of the options that we are offering for our Wayne Highlands students for the fall. Okay, option one is our traditional learning. That's what I'm developing a plan for. I am developing a plan for students to be here in school Monday through Friday, normal times, maintaining in-person connections, following health and safety protocols in order to continue that as long as possible. Okay, and that's involving our classroom settings, our lunch settings, and all the benefits of a Wayne Highlands and a Damascus education. Option two that I'll be talking about a little bit more is Wayne Highlands Live. And this is our, if this is the best point of reference I have for you is the spring when our students were all on Google Classroom, but consider this Google Classroom new and improved. So if the reasons for your decision land you here, we'll talk about what those are in a little bit, then you would expect your child to be able to access the same Google Classroom settings that they did in the spring with some augmentation and some improvements. Our third option that I'll be discussing tonight is our Wayne Highlands Virtual Campus. This is an online program that we coordinate with a partner network of teachers. And I'll talk a little bit more about that as we go. And then at the very bottom, there's a reference to a survey that I'll talk about as well. So we'll move forward a slide, please. Option one, our traditional learning. This is what school will look like at Damascus. If you choose to send your child to Damascus, this is what you should expect, okay? As a part of this, you're a part of our team. All of our parents have a responsibility for any students who come to our school. Before school is when our major symptom screen will happen. I have a later slide that'll talk about what that screening looks like and how we will help follow that same screening process at school. If your child rides district transportation, they will be required to have a mask on. They will be required to have a mask on upon entry at school. All right, we are able to, currently, under current guidance, we are able to put 2 students to a seat in each seat on the bus, allowing for 44 students on a bus, masked and seated distanced apart, that 3 feet with a mask on. So that is what we are going to go with. There is no exception on that. His child must have a mask on the district transportation. If that is impossible for you, I want you to call me. Okay, I want to talk about that first. But that is required for our students to ride district transportation. Also, when they arrive at school, until they get to the point where we are able to reduce our mask usage, which we'll talk about in a little bit, they will be required to keep that face covering on throughout their first maneuvering around the building. Around the school, you'll find that our students will have access to sanitation stations with hand sanitizer and some touch-free dispensers. Also, there will be hand washing routines that we will talk about at great length to help throughout our day. I'm very thankful that in just about every single setting at Damascus, we will have a lot of mask up time and mask down time. Now, what I mean by that is when I'm able to build a schedule and we are able to keep our students 6 feet apart, our teachers will be able to instruct students, this is mask down time. A lot of your child's instructional day, as of current enrollment and current classroom sizes, will be mask down time. So your children will be able to spend a lot of their instructional time mask down. Now, if the teacher delivers instruction and wants to circulate the room to check on something, that will be mask up time. And that I've talked with our teachers about building that into their routines. That's just going to be the way that we're going to be able to mitigate things, but I'm very thankful that I'm going to be able to offer that. There are a couple of classroom settings where, depending on how many students join us in the fall, we won't be able to have mask up time or mask down time as often, but we will talk about that with those specific families as we go. But just about everywhere around the building, they will be able to. Lunch. I'm working on a final plan for classrooms or cafeteria where our lunches will be delivered. I'd like for them to be offered in our cafeteria or in the areas around our cafeteria, but some of that will have to depend on final enrollment numbers and what families choose. Packing lunch is fine. It's a good thing. And you should, if you do that already, you should feel comfortable doing that. Okay. Playground usage. We'll talk about that for a second. A little aside, last week I was on vacation with my family and we were at a state park, had a playground. And the signage around that playground was very clear that when you use this playground, you were to have a mask on, you wash or sanitize before you use it, you wash or sanitize when you're done. So based on guidance that we have, we can follow that same protocol at Damascus with that mitigating measure in there. Our students can hand wash before they use the playground. They're able to use their mask on the elements, maintaining a 3-foot distance with the mask on, and then hand washing after. Now, there's going to be children who do not want to have their mask on the entire time out at our recesses. That's fine. We'll have space to spread out. We'll have other games and other activities that are designed to keep more distance so that students can have that mask down for outside time. But I want you to know that we will have a protocol for using some of the equipment during that recess time. We will not be using our lockers in school this year. We've talked to our teachers about reducing the amount of paper that's going to and from home and the amount of materials that have to go into and from home. So we will be using the Google Classroom method for using a lot of our homework. If a child is not able to access things at home through Google Classroom or needs a paper copy, we'll make them available. All right, the point is not to exclude anybody from being able to do homework. The point is to reduce the amount of materials that are coming to and from home. So you can expect that your child may have a backpack, but really nothing beyond the absolute essentials during the day. Our lockers just are not spaced out far enough to be able to use them in the way that we traditionally will. So what comes to school is going to have to be in a smaller package. We are working on building a schedule that reduces our transitions during the day. In our K-2 or K-3 classes, that means that our students will basically be in their classrooms throughout the day, as they always have been. Special area teachers will come to the classrooms with the exception of the gym. On the gym day, we'll be able to go down to the gym and we'll have some routines for being able to move around the gym and get some exercise, as we always have. But our music, our art, our other special area teachers, they will be traveling to those classrooms. Grades 4, 5, and 6, pardon me. We are working on an alternating day schedule where one day will be with the teacher who's doing their ELA program, their language arts and literacy program, and that's where they'll stay with that teacher throughout the day with their normal breaks that we've already discussed a little bit. And then on the other day, they'll work with their math and science and social studies teacher in that classroom. We understand from all the science and all the guidance that when things sit overnight, we don't have a concern about transfer of any sort of virus as materials sit overnight. We also have incorporated foggers into our cleaning routines for our custodians, and they will have a machine that basically is able to fog a room with a disinfectant that will land on all the surfaces and dry overnight so that the next morning our kids can have a clean room to come to. So that is a good thing, and we are excited that we can still have some transitions. At the 7th and 8th grade level, we're working on a rotating block schedule that will allow for maybe 2 or 3 transitions throughout the day with a time in between for a room to be wiped down before another group is to use it. The exact details of that I'm still working on, and some of that will depend on which options our families choose. But I'm very confident that it will turn into a very good instructional setting as it always has been, and that our teachers are up for the challenge. The benefits and drawbacks, hey, there's no better benefit to being in school than being in school. I'm very confident in saying that if our mitigation efforts are successful, we can remain safe and remain in school, and we're there. Now, the drawback, the inherent risk to all this is that we are still in the midst of a pandemic. We are still in the midst of a situation where I make no guarantees, and I can only say that with some measure of factuality that Schools are going to have cases of COVID-19. It may happen at Damascus. We have plans, we have understandings of what we are to do. We'll talk a little bit more about those as we go. But that is that's a risk. Okay, we're not going to pull any punches on that. But I know in my own family, that's been a conversation with my children. We've understood that, hey, we want to be in school. That's what my kids have said. Well, in order to be at school, wear the mask when you're supposed to wear the mask, wash up, make good decisions about your health and the health of those around you, and go to school. And that's our plan in my household. Okay, as we go into some of the other options we're going to talk about, that may be a more complicated decision. So let's do that. Let's move on to the next slide, please. Well, before we talk about option 2, let's talk a little bit about this symptom screener tool. You're going to see this from my office for those students who are coming to school as we get closer to the school year a little more officially. So this won't be the only time you see it. But this has been distributed by the Pennsylvania Department of Education. And this is a symptom screener that's a very basic one, but it's very useful. Okay? If a student has one or more of the symptoms in group A, keep them at home. Okay, if they have that fever of 100.4 or higher, if they have that cough, that shortness of breath, the difficulty breathing, keep them at home, contact your doctor. If they have 2 or more of the symptoms in group B, keep them at home. Now again, some of the symptoms in group B related to COVID are more rare, some are a little more common, but what we've come to understand about this coronavirus and the COVID-19 disease is that the range of symptoms that people have is very diverse. So that list is there to kind of be a guide, and if that will be a screening tool that we will use at school as well if someone starts to feel sick throughout the day. You can go forward a slide. To continue the discussion on health and safety protocols, our nurse will maintain close contact with any of our students with vulnerable needs such as asthma or diabetes, just as they always do, but certainly with a little more attention to any of those symptoms that we talked about. We'll have hand sanitizer and disinfectant available and ample opportunities to wash hands. Our heavy cleaning protocols, I referenced a few of those already. We're going to ask that all of our students bring their own water bottles. There won't be any water fountains turned on for public use. You'll notice, well, you may not notice because we're not going to allow many visitors in the school, but there will be many signs and cues around the building of either markers or signs indicating the direction of walking in a hall, what's 3 feet, what's 6 feet, what's mask up time, what's mask down time. These are all going to become part of the routine of being in school. They are there to ensure that we can have a safe educational environment. They are not there to overtake what we do, but they will require some rehearsal and some instruction, and that's okay. If our students are in a situation where 6 feet apart is not possible, we're going to make sure that we offer them enough mask breaks from time to time. That may involve getting up and moving outside and using an outside space or a large indoor space where we can spread out. A question that I know many of you have, and it's an important question, is if there's a positive COVID-19 test. We have a responsibility to collaborate with our local health officials regarding a positive COVID-19 test. We recognize that I won't be administering COVID-19 tests. Our nurse won't either. If a child is symptomatic of things, we're going to be in contact with you, and we're going to recommend that you go see your physician. They will make the recommendation over what tests have to occur and if somebody is symptomatic or asymptomatic or is likely to be infected with something. We will then follow their guidance, and there's a link there, and there's many other links that you can easily find that have to do with when to quarantine, who has to quarantine, and things like that. One of the benefits of option 2 that I'm going to talk about shortly is the ability that if we do have to have a student quarantine or a group of students quarantine, that we can account for their education, even if that occurs. But I want you to be mindful that we are going to work with local health officials regarding anything that results in a positive test and make sure that we follow that local guidance or that health guidance. You can go forward, please. All right, we'll talk about option 2. Option 2 is our Wayne Highlands live streaming interactive virtual education. This is going to be similar to what all of our students participated in the spring. They'll have access to Google Classroom. The difference is that our teachers will be providing live instruction. They may be recording lessons live. They may record some lessons ahead of time and then deliver them in the classroom setting, where the children who are at home and taking advantage of option 2 can access and watch and have an opportunity to interact with their teachers. If a student is an option 2 Wayne Highlands Live student, but is not able to access that instruction during the day when it's being delivered, maybe they're at a grandparent's house during the day and they don't have internet access till the evening, or whatever reason, they will be able to access those archived, saved videos in the evening, as well as the activities that teachers will be uploading to the Google Classroom setting. All right. This does not require an enrollment change. You would simply indicate option 2 on the parent survey that you're going to see delivered later this week and with a deadline of next Monday. So if you choose option 2, please know that we'll then be in contact with you about understanding what that means. Regarding attendance, we are working on a final plan for what attendance looks like for Wayne Highlands Live, but please note that it will very likely involve some measure of measuring work completion. When you make this choice, if you make this choice, you're committing to that for the first 45 days of school. In other words, we don't want families to come in and say, well, we're going to school this week, but we're going to stay home next week. And then we're going to go to school and then we're going to stay home. That's not going to work for anybody. So if you choose this, you're going to stay in this setting for the first 45 days of school, at which point you'll be asked what your choice is for the second marking period. Is this a good option for me? You may have may have concerns in your house related to medical conditions, or of the student or of anybody else in your home. There may be a lot of reasons why option 2 is very appealing to you. Some of them, well, all of them have a lot of ammunition behind those reasons as to why you feel that way. We're not here to debate those reasons. If you choose this, please know that our most successful students in a live online setting are going to have a manner of self-ambition and be a good self-starter. They're going to have to be able to maintain on-task engagement with our lessons, potentially for a long time during the course of the day on their own. Maybe they'll need somebody over their shoulder. If they're a little bit older, maybe they don't. That's going to be an individual choice that you within your households have to make. I can't tell you whether this is a good option for you, but I can encourage you, if you don't know, to call me and we'll talk through it and we'll find out. You're going to need an internet connection to be able to make this work. You should have a device. If you don't have a device that can make this work, but you do have an internet connection and this is still an option that you want to talk about, call me. We'll talk about what our options are to get a device in your hands. I don't want to dissuade or take anybody's option to select Wayne Highlands Live away from them, but I do want you to all recognize that being a good online learner requires a support team, and it requires some dedication on the student's part to make it work. So that's something to think about as we go. One last thing before we move ahead, Scott, because this came up in our last meeting with our Preston families, was about parents being tech savvy. Mr. Miller and I talked with some parents in the last meeting about making some opportunities available for our parents to get a little more training on how to help their students navigate the Google Classroom setting. And we will be talking more about how to do that to support those families who make this choice. All right, so that will be that. You can move ahead, please. Option 3 is our Wayne Highlands virtual campus. To define this a little bit better, this is an option where you remain a Wayne Highlands student, but all of your instruction and classroom classwork occurs through the virtual setting with teachers who are contracted through the Virtual Learning Network, the VLN. This is an agency that provides K-12 education options. We contract with them, and this takes you away from our enrollment in the sense that you are still a Wayne Highlands student. I'm still your principal. Mrs. Grease is still your counselor. However, you are working entirely separate from us with different teachers, okay? Mr. Chris Roos is our virtual campus liaison for Wayne Highlands. If you have any more questions or want to know more about Wayne Highlands Virtual Campus as an option for you, I would encourage you to reach out to me through the Damascus School office or reach out to Mr. Roos through the WHVC email address on your screen. There are benefits to being in the Wayne Highlands Virtual Campus. You know, you're able to do a lot more asynchronously if that is more of a benefit to you on your own time schedule. The drawbacks, as I indicated, are you are doing a standards line curriculum, but it's not our curriculum. So any transition to and from our setting is a bit more difficult, and it's for other students that we've worked with, it's been a bit more difficult of that movement in between settings. So it is an option for you. It may be one that you want to explore, but I'd encourage you to talk to us first. All right, you can move ahead, please. So I've talked for about a half an hour. I've talked about some options. I've talked about a few things that are going to be that you can expect to see. I haven't talked about everything, but I've talked about enough that you should be able to at least think through any questions you might have. And I would ask, if you have them, as you ask them, to make sure they're general enough to benefit many in the audience. If your question is more personal to your situation and it's something that you'd rather talk about individually, you see my contact information there, either here at the Preston School or at the Damascus School or by email. And I'd encourage you to do that. You know, our parent survey is going to be opened up here over the series of the next days. And by next Monday, we're hoping to have a lot of people to have registered their decision so that we can make the appropriate plans for the fall. So at this point, as I open it up, you can either unmute yourself to ask your question. You can type it into the chat function, which you can open through the bottom of your screen. And we have a good amount of time. So anything that you feel you need to ask in this setting, now is your opportunity. So I open it up. Well, the first question, all right, from the Troop Schaefer household, middle school sports. I see it on the chat there. Middle school sports, as of right now, is preparing to open. If that were to change, obviously you would hear. But as of right now, they are making preparations to go forward with that. Tammy, I see you came off of mute. Do you have a question?
Yes. I don't know if I'm doing this right.
Well, I can hear you, so you're doing it right.
If a student has a TSS Aid, are they allowed to go to school with them?
Of course. We will just have to talk about the same mitigation things with that aid in place as we would with anybody else.
Okay.
I would encourage you to call me.
I absolutely will.
Okay. Right now, the kindergarten question. Kindergarten is to be full day at this point, yes. We have a number of kindergarten students that right now we are waiting to see how many choose to be with us. So, but right now it is full day, and then we'll make a decision on classroom settings after we have decisions from folks. Coats and school bags, students will largely have their school bag with them, and coats, when it becomes necessary, we will come up with a solution to have them in a space, in a room. So that will, I don't want you to be discouraged from sending your child in a coat when it gets cold. Good question. These are coming up in the chat, so I'm just going to keep talking about them. In the live option, how much time will children need to be on the computer each day? It'll vary a little bit from grade to grade and class to class. Tammy, I'll ask you to put yourself back on mute there. In the live option, how much time are we on the computer? It'll vary a little bit from grade to grade and class to class, but you should expect your child to be busy most of the day. You know, with the opportunity to offer live instruction and for the child to access the classroom, they should be busy for a good chunk of the day. Plan on that, okay? I would imagine that would be reasonable. Special education classrooms transferring. I think whoever's asking that question, I would ask you to direct your question to Mrs. Amanda Kerna or Mr. Pat Blaskowitz, or call me at the school. Attendance. We are working on discussions about attendance and our current attendance policy. We have not made any changes to our current attendance policy at the district level. I do not know that we will, but we will understand and we will work with families who have need for, not being in school related to medical reasons. All right, so please know that we want to work with our families regarding any medical reasons. And you can call me more directly about that if it's more specific. Class sizes be limited. Our class sizes at the middle school level, I'm currently working on making sure that they will be limited to the amount of students that we can maintain 6 feet apart. So they won't be limited in the sense that we'll be adding more teachers or more rooms, but we are working on having a schedule that allows for a lot of mask downtime during the day, during the instructional time. Okay, and again, I referred to that earlier as an opportunity for children to have their masks up and down as the teacher makes that work. The question about temperature checks is a good one. No, right now we've come to understand that a temperature screening, especially for a kid who may be coming off a hot bus with a coat wrapped up around them, is not necessarily a screening measure that is accurate. Okay, if a child were to complain of any symptoms or feeling anything at all, then we would certainly obviously do a temperature check. But we are not planning on mass screening every student as they come in. If students are come to attend the school throughout the year, well, my guess is that that question has to do with if they're coming from an area that we would have any concern about. And I guess we'd have to talk about that case by case. I really don't have any other answer for that. I certainly wouldn't have a blanket policy about quarantine or anything like that until we would know more about this individual student situation. So that would be how we would handle that. If we choose option 1, can we change our mind after the first marking period? At this point, we are planning to resurvey our families each marking period if they need to or decide to or want to change their mind and choose a different option. So at this point, yes. If a student chooses the in-class option and then the parent decides to go live due to the circumstances changing, is there the same 45-day restriction? I would tell you, I would ask you to call me in that circumstance. If there was a reason why your child wanted to go to our Wayne Highlands Live option number 2, we would certainly talk about it. Okay, I'm not going to rule anything out, but I want it to be for the right reasons. And there are many reasons that are probably right. Okay, the reasons that I don't want it to be for is because I can get more video game time if I'm on option 2. So that's why I would want to discuss those, but we certainly would keep that opportunity open. With option 2, will teachers be live all day? At younger grade levels, you can expect that our teachers may have more time during the day that they're live because more of that instruction happens in fluid ways, moving from large group to smaller group or with smaller groups at a table or things like that. I can't answer fully until we kind of work through what it would be in terms of how much of the day will be online. Different teachers, different settings will have different expectations. Can students watch as they can and watch pre-recorded when needed? Yes, that's the type of circumstance, like I said, if you're keeping your children in option 2, there may be a time of the day that they're going to an appointment or just not around the internet or not have a device available. We're hoping to be able to make that work the best we can, okay? As I said to start this, we're learning as we go along with this too. Just as I've never opened a building in the middle of a pandemic, our teachers have never attempted to work with students in both settings at the same time. So we're going to learn as we go. We're very good at teaching and at learning, so we can do this. Class dojo, each teacher will make their own decision about how they communicate with their families. So they may continue to use Class dojo, and I would imagine that any students would be included in that. Okay, the question is, you said that homework will be Google Classroom. Do they need to have a tablet of some sort to go to and from school? Well, if our students are in school and they're going home and they do not have access to Google Classroom in the evening to handle their homework, then I can say with some certainty that we'll make paper available for them in almost every circumstance. So that would be the type of thing where we would not issue a new tablet for that student, no. will temperatures be taken before entering the school? I did answer that. They should be taken at home. As I indicated earlier, your home screening should involve that. And then we would take them throughout the day if the child complained of not feeling well. Can a student have a chance to change to traditional learning from remote or online learning? Yes, as we go along, we will survey our families and parents. We would like that to occur at a natural break in the school year around the change of a marking period, unless there's a real circumstance why we would want to. So when you make your choice to start the year, we would ask that you give that choice the full marking period to play itself out. It's going to be very difficult for us if we have students moving in and out of that setting very often. So we would like you to make that choice and commit to that for the first marking period. If a child tests positive for COVID, how will the rest of the class be notified? How long is the window between the child being out sick and notifying the rest of the class? This is a very good question. This is one that is maybe a bit more complicated. As I indicated earlier, I am not able to direct a quarantine situation. We work with our local health officials to make the right decisions about that kind of circumstance. Having said that, I also am at the, I'm bound by various laws that have to do with student medical condition and anonymity and privacy. And so I might not be the one to communicate with families about if their child has been exposed to someone with a COVID-19 positive test. But I can tell you that we will be the ones to work with local health officials to provide the lists of people who may have been exposed and let that contact tracing, which is a term you probably have all heard, occur through those people who are trained to do so. What that means is for you, anything related to quarantine windows, if that is made as a decision, there are some guidelines and some frameworks that you can find through the CDC website and through the Pennsylvania Department of Health that govern what some of those windows are. So I'm going to direct you to some of those resources to help with that answer. If a student reports midday and has illness symptoms, well, that's part of that parent screening that we do for all of our students. So if a child comes midday, obviously our nurse will be there to welcome them and to see them, but that has to do with that parent screening. That parent screening is going to be something that I'm more clear about as we get ready to start the school year. All students will be at desks, their own desks, in their classroom settings whenever possible. So that includes kindergarten, first and second grade. We'll be moving desks into all of those classrooms. If a positive case in the school and a classroom, how will quarantine protocols be handled? I think I answered some of that. Will the whole class be quarantined? Some of that decision has to do with some of the language and some of the guidelines that we receive from the State Department of Health and from our local health officials. If we fall into a setting, here's where I have to be honest with everybody. There are going to be COVID-19 cases in schools. I can't say that they're going to happen at Damascus, certainly, but I can't say that they won't. And if and when they do, there is language and there's guidance out there that we've seen that has to do with, if one student tests positive, is it contained? When did it happen? How have we done with our mitigation measures that I've reviewed multiple times to this point to ensure that other students, that spread is going to be minimized? When a spread starts to occur, then decisions are made by Mr. Frigoletto in the school district that have to do with potentially closing a classroom or an entire school building. One of the benefits that we have of our Wayne Highlands Live setup is that we can transition a student from the in-class setting to the Wayne Highlands Live Google Classroom setting very seamlessly. So if a class or a student or a group of students needs to suddenly be transitioned away from the classroom or the school setting, we can manage that and not interrupt their education. I'm going to read the question. I mentioned if there was a positive case, the school would be consulting with health officials. Is there a protocol in place for what will take place for the duration of the results coming back, such as exposure notification? Some of that, like I said, is going to have to be dictated by what our health officials would do in a setting outside of a school, okay? One thing that we're going to all have to learn is that panic is not going to be our friend. And I'm not implying that that's what that question says, but I am telling you that as we are allowed to, or as we are directed to share information, we will, okay? If the school does not open for whatever reason, are we ready to immediately roll into an online program? Yes, I can say with some measure of confidence that we will be much more prepared to move into a Google Classroom online remote learning setting than we may have been last March or April. That's a positive. We've done a lot of training with our teachers about Google Classroom and improvements to what our level of expertise was in the spring. And so we would be able to move into that much more seamlessly. Yes. I'll read the question. Regarding consistency of education, would you recommend the live online option if students might show symptoms of exclusion yet not related to COVID? If the students show these symptoms during the school day, will they be sent home immediately and transferred to the online? Okay. If a student is symptomatic of something that resembles COVID, let's say they have a fever and they have 101 fever, and we call you up and they say, you know what, you got to take your child home. The language that we have says that you then have to call your doctor. You need to communicate with your doctor about what happens next. On our end, all of our students will be enrolled in their Google Classrooms. So certainly for the time that they're home, they can go ahead and log in and participate that way. And then if they are not considered as thought to be positive for COVID, then there is language related to being fever-free for a period of 24 hours before they can return, and you would be in communication with our nurse about when that is. So yes, that's a great question in terms of being able to continue to work with the Google Classroom setting while they are home. It's a good question, I appreciate it. Michelle's question is a mental health professional, and I apologize if I missed this, she says, will guidance be meeting with the students, with the children to discuss emotional adjustments back to school and in case we end up in red? Yes, Mrs. Grease and I have talked about how she goes about those initial conversations with our students. It's an adjustment for all of us. Our younger students, our older students, my children at home, it's a big adjustment coming back. There's excitement, there's nervousness, there's anxiety, and we will certainly be talking a little bit more about how we manage that conversation as school personnel as we get started. I can't put it all just on Mrs. Grease. All of us will be involved in that conversation. And we'll be talking with you as parents as we get closer to the start of the school year about how that conversation has to start at home, okay? Is the face covering provided by the school if one gets lost or damaged? Yes, we will have a store of masks on hand if one gets lost or damaged or needs to be handed out. We will absolutely have that. Kim's question, how will they be able to unmask or have mask downtime in the classroom? Well, I can tell you that in our classroom settings, when we have 17 students or less in just about all of our classrooms, and in a couple of them, we can have about 18 to 20. They're seated 6 feet apart. I made a big triangle out of wood. I took it around and I measured it all out. And the good news is when they're 6 feet apart, that's that understanding that they're safe for at least that time. So we'll be able to do that with some assurance that we are 6 feet apart and using that guidance. It may seem like a small space, but 6 feet is manageable in all of our classroom settings at this point. Will they still be switching teachers and classrooms? Well, I indicated earlier that for our students in K through 6, they pretty much where they start the day is where they'll be, with the exception of going down to the gym where we can spread out a little bit more. We'll have some recess time where they'll be outside and be able to spread out. Our lunch setting may be in the classroom, it may be in the cafeteria. I'm working out some final details on that. At the 7th and 8th grade level, we'll have some limited classroom changes with some time in between to be able to wipe down surfaces and clean areas before a new group comes in. How will the school buses be sanitizing? Mr. Farmstone, our Director of Transportation, will be meeting with our drivers over the next weeks, and he'll be talking about protocols for cleaning. But at the end of a run, after students have been dropped off, they will sanitize, and that'll sit on there for the day, and then they'll do their evening run and sanitize at the end of that. Kirk, in-person school is 5 days a week. Yes, that is option one. Nicole, I think I've answered that question regarding special classes. Those special teachers will be coming to the classroom other than the gym. Maybe the library, but I think we'll do that in the classrooms as well. We will be able to check out books. The question regarding mask up, mask down time. Is there an increased risk of exposure with children touching their faces in masks? Well, one of our mitigation strategies that we need to do a very good job of has to do with hand washing and sanitizing. And if we're hand washing and sanitizing as we're entering spaces, we then are only using our own space. So we shouldn't have transfer from another person if we've done that correctly. That's part of our challenge. And that's part of what we have to do. If you would like to talk to your children that if they are offered mask downtime because they're 6 feet apart and they're safe in that instructional time, but if you'd like to tell your child not to take their mask down, by all means do it. And we'll have a discussion with all of our students that it's certainly an individual choice and certainly something that is appropriate. Has the curriculum been adjusted to cope with the long gap of not being in school? I can tell you that we've had conversations with teachers already about what do we do to recoup some of the time that we've lost. And you know, we're not going to completely go back to where we would have been in March and start over, but we will be doing a lot with early assessments to see, okay, where are we? Where do we have to go to? With the understanding that we may have to backtrack some with our students. Hopefully being able to do that in a way that doesn't completely move backwards. The question is a good one from Jessica. Is there an intent or an idea to do classwork or lunch outside while the weather allows? Yes, that's a perfectly great option. And we will certainly be able to do that as the weather allows. We're blessed at Damascus to have a lot of space. So a group could go out to the baseball field, a group could go out to the hill behind the cafeteria, and certainly be able to have a class spread out and do that. We're going to encourage that. Will children be masked down for the majority of the day in the classroom? When the teacher is delivering instruction, if you could almost envision where I am right now, okay, I'm delivering instruction or I'm talking from one space, okay, and the rest of my students are out there. And if I know that they're 6 feet apart because we've spaced out all the desks, I might be able to say with confidence, now's mask down time. How long is that? Well, that'll depend on the individual teacher. How much time do they want before they walk around the room and check what everybody's doing? So I hope you'll understand that there's going to be a mix of both. Are there going to be a minimum amount of students in each class? As of right now, I don't know that I would want to answer that question because we may have students who choose one option and then choose a different option. So for right now, we're going to wait and see where our numbers shake out after our decision. Will students be required to wear masks in classes with more than 18 students? That depends on the size of the room. If I can fit 6 feet apart, we'll be able to take masks down for some time. How are exams conducted in the live option? That's a great question. Our teachers are still working through what some of that is going to look like, but you can rest assured that some of our assessment will be able to be delivered in that Google Classroom setting through being able to type it back and forth, writing assignments, things like that. Some materials, all of our students in option 2 will be provided with their appropriate instructional materials to start the year, their workbooks, their various things. There may be a time where we ask for somebody to come pick up some materials to take home to do, might involve an assessment, and we may have a routine for bringing things back to the school to return to the teacher. But by and large, we're hopeful that it can be done online. Should we send hand sanitizer in with our children? If you feel comfortable with that, I'm not going to get in the way of it, but I will tell you that I would want it to be just theirs. So the best option I would say would be to have it like in a lunch bag if they're packing a lunch, or in a backpack or connected to a backpack so that it's not shared around. But that's fine if you want to send that with your children. Restrictions on the type of style of masks they are allowed to wear. Obviously, I wouldn't want anything that has anything inappropriate printed on it. You'll see in the mandates that were handed down from the state regarding what a mask is, it's pretty loose, it's pretty wide. I would tell you I would want it to be something that has some sort of permanent, whether it's elastic or goes all the way around the head. I would not want it to be a bandana that's just loosely tied. But there's a lot of leeway in terms of what a mask is. The purpose of the mask, again, is to contain your own respiratory droplets. So there's not a lot of guidance that dictates exactly what it has to be, but it should cover the nose and mouth. Will students need to use a mask for gym class? We are working on that final answer. I am hopeful that they can take it down for activities that are spaced out, but if activities start to involve closer contact, yes, they might have to wear it. So I'll be working with Mr. Patriso on what those activities can look like. But again, if we can be spaced out and doing something, we'll be able to take them down. Will live start at 8 a.m.? Well, it may not start exactly at 8, but it'll probably start sometime around 8:30 when those first period class starts. They should be able to get on. Again, that's if they are taking advantage of the synchronous option. If they're not taking advantage of synchronous option and they're going to be working at a different time of the day, well, then they may be able to access things at different times of the day. But we'll have a better idea for our Wayne Highlands Live families of what schedules will look like and what times of the day you should expect certain things as we get closer to school and as we know who's selecting that option. Will there be kinder camp this year? Not in the traditional sense, but we will. Mrs. Killam and I will be talking about how to have an orientation and an opportunity to get used to the school building as we get closer to the school year. Okay, this is a good question. In the past, hand sanitizer had to be without alcohol to bring to school. Yes, that has changed. We recognize that non-alcoholic hand sanitizer is not effective against the coronavirus in question. So if hand sanitizer is being brought to school, it should be at least 60% alcohol. But I will tell you that it's something that I still want you to educate your children on, knowing that they are children. And social pressures being what they are, we've had some horror stories, not necessarily in our schools, but in other schools with children who have not used it responsibly. So make sure you educate your children if that's something you decide to do. Will we receive a list of supplies needed for live? Well, that's a good question. I don't know that I have an exact answer yet, but we will say this. When we know that families have chosen that, we'll do a good job of making sure we communicate. We may have another one of these sessions for those families specifically when we get closer to the school year. If circumstances change, will children be able to go live and return in the new marking period? Will the marking period dates be shared so parents can prepare in meeting their family needs? Yes, the marking period is a 45-day stretch. It's usually 9 to 10 weeks, depending on when weather starts to hit. I don't want to lock us into an exact date just yet, but you can imagine that'll be sometime around early November when we would be talking about that. When will school supplies lists come out? Well, we need to make class lists, and some of that will depend on when this decision is made for families. So that will, again, be something that comes a little bit closer to school. Yes, and I would imagine that we would will be sensitive to the fact that students may be carrying or hauling around all of their materials from throughout the day without a locker. But we will be having, we'll talk about how to have the appropriate amount of materials to make that work a little bit better. That was a good run of questions, folks. I got to tell you, that was all over the map, and that's fine because they were great questions. I hope I was able to answer some of them. I hope I didn't frustrate anybody too much. Like I said, this is a first time for all of us to deal with this, and I think we're in good shape. The one thing that I'm very blessed with is, and somebody asked me recently, has anything recently warmed your heart about whatever? And I said, you know what? One thing that has been particularly touching has been in both schools, in the Damascus community and the Preston community. Our school communities have really rallied to work together to make the best of what has been a really tough situation. So I'm really, really thankful for all of our parents and all of our families for everything you've done to support us at school to make this work the best we can. We're learning together. We'll figure it out. A lot of your questions and a lot of your thoughts are things that maybe I haven't thought about yet, and I appreciate them. So they will go into that next round of decisions. If you make a decision by the 10th and change your mind before the start of school, yeah, I want you to call me, okay? And don't hesitate. Call me. We'll talk it through, okay? I don't want to pigeonhole anybody into a situation, but at the same time, we need to get plans together. So I would ask you to be thoughtful about your decision and be ready to commit to it when you respond to that. But know that if circumstances change for you, that you can call me. And I think you know that I've been very open over the years. I've gotten to know many of you very well over the years, and we can do this. I appreciate the thanks there, Michelle. And it's been a large undertaking, but it's been something that, you know, like I said, we don't do it alone. We don't do it in a vacuum. We have to work together. And that's going to take all of you and all of us to continue to make it happen. So if you're choosing to send them to school, be responsible. Train your kids. Talk to them. Make sure they're doing things the right way. If you're choosing to keep them at home, make sure that you're doing the best you can to be that support, knowing that we're going to do the best we can to make that experience valuable. Okay? Assuming that that's the end of the questions, and I'm sorry I didn't get any voice questions, so if you meant to chime in, and if you have another question, I'll go ahead and leave it open just here for a few more seconds. So if anybody has a vocal question that couldn't type it out, jump in. All right. Well, reach out if you need to. Call me. We'll talk it through. There's a lot to think about. You've had things to go home and digest or sit at home and digest. And I really do appreciate all of it. All right. We'll be in touch. Have a great night. All right. Thank you so much. Al, the last question yes, the live option will be done through Zoom and through Google Classroom. Yes. All right. Hey, have a great night. We'll talk to you as it goes along. Take care.